Hello everyone, I'm Dr. Sri Durga. I'm the fertility specialist at Virinchi Hospital Fertility Center. It's been an anniversary now since this virus corona has entered our human lives and having created this chaos. December 29th 2019 was the first patient reported in Wuhan, China. So this novel virus pandemic of corona across the globe has created an unparalleled situation where our social, financial systems got influenced, including our healthcare systems, where the government was left with no choice but to introduce these emergencies and lockdowns, where non-emergency services, especially the fertility services, were shut down. But having gained reasonable experience and control over this virus, all the lockdowns are getting unlocked now and the life is getting back to normalcy. So during the initial part of the pandemic, the couples were warned to delay the parenthood because absolutely there was no data whether this virus would affect the reproductive organs of the man, the woman, or what's the effect of this virus going to be on the pregnancy and the baby. But it's been 1 year. We have reasonable data coming from all over the world now. So let's look into the effect of this virus on the fertility as such, that is reproductive organs. So luckily this virus is not going to affect the reproductive organs of the woman, which are the ovaries and the uterus, and absolutely the trace of this virus has been not found even in the eggs when the woman had to undergo IVF. Coming to the man's testis has got these receptors called ACE receptors, which you might have heard quite frequently now. These are the receptors which are present in abundance in our lungs, heart, etc. And these are the receptors where this virus wants to go and sit. So the human testis harbors these viruses. So we have data from a similar epidemic from SARS virus a few years back, but it's not the COVID-19 virus. So in that epidemic, they have found that this virus affects the human testis and it has created a situation of inflammation in the human testis. And the man can spread the virus during that active phase when the testis is harboring this virus to his partner. But it's a common sense. When you're having the active infection of corona, you will be anyway quarantined. But the reassuring part is that this virus has got no long-term or the long-standing effects on the human testis nor on the man's semen. So the reproductive organs, there has been no long-standing effects. Now coming to the pregnancy and the effect of this virus on the baby, there has been reasonable data as well coming on the pregnancy. This data has come on the second and the third trimesters of the pregnancy. There is no data coming from the first trimester, that is the first 3 months of the pregnancy. So the data is very good, in fact, very reassuring. There has been no untoward effects have been reported of this virus affecting the mother nor even the baby. Yes, there has been some transmission from the mother to baby, what we call vertical transmission, as low as 3%. So except for here and there reports of preterm labors, but that is a causal association rather than the virus itself causing the preterm labor. There have been no untoward effects reported regarding the effect of this virus on the pregnancies. Even babies born to these COVID positive mothers have been healthy. So absolutely reassuring data. So the couples now can be reassured to try for pregnancy naturally or through fertility treatments. Now coming to the other part, now we are all eagerly waiting the entry of the vaccine. So the vaccine is going to come in the next few months. So the next question is whether couples, should they delay taking this vaccine, or is it safe to take this vaccine and try for pregnancy? Mind you, the phase 3 trials of this vaccine have been not conducted on pregnant and lactating women, though they are planning in the next few months. But absolutely this vaccine, the trials which have been conducted on young people have showed no untoward effects on the reproductive organs. So it is safe for people who are contemplating pregnancy to have this vaccine. There is no reason for any young couple to delay their pregnancy or their fertility treatments if they are planning to take this vaccine. As you're all aware, this vaccine, whatever type of vaccine our country is going to get, you need to have 2 doses, 3 or 4 weeks apart. So we do advise the young couples to have a vaccine and then safely try for pregnancy, or can safely go ahead with their fertility treatments.